In today's Hometown Expert, Claudia visits our friends at the Institute for Women's Health to find out more about a topic that affects a whole lot of women, but doesn't get talked about a whole lot. We do want to let you know this can be a sensitive topic that may not really be appropriate for small children.
Hey ladies, it's Tuesday and that means we have an appointment with the doctor, and today we're going to talk about something very important because it affects a lot of us women who've had babies. It's called pelvic organ prolapse, and what that is when everything down there starts to hang. Now the problem is it could affect your health and also your marriage. So with us is Dr. Vincenzo Sabella. How are you, doctor?
Fine, how are you?
I am well. So what happens after we have babies?
Well, the pelvic organs, which are mainly the vagina, the bladder, the rectum, the uterus, they start falling into a bad place because the tissues become a little weak, especially after having babies.
Sure.
And that doesn't happen immediately after having a baby, usually because women are younger, and because they have a very good tissue support.
Right.
As the woman grows a little older, those tissues start becoming a little weaker, and things start falling out of place.
Right.
And it starts by noticing a widening of the vaginal opening, all the way to feeling actual bladder coming out of the vagina, a bulge coming out.
Okay.
Incontinence of urine, that's another common presentation. Sensation of pressure. Notice when all those organs are getting weaker and they start falling a little bit.
So this can be corrected, and what is the process like?
Yes, the process of correcting it in the past used to be a major surgeries. Now we have available a number of minimally invasive procedures, even robotic surgery that we can do to lift up the bladder, lift up the uterus, or in severe cases, even remove the uterus if it's falling all the way out.
Okay.
And also, we can put a vaginal wall into place and even doing a tightening of the vaginal opening, which is known by a lot of people like vaginal rejuvenation, but in reality is a part of procedures that are designed to repair and bring back those organs to their original place.
Exactly, and that's so important because inside there's a bunch of vital organs that we need to be in place. And this process takes care of that, but not only that, but it tightens our goods, ladies, and that is going to be helpful in a marriage because it happens after you've had babies.
Yes, as I said, some of the first signs of this is that the women start noticing their vaginal opening is a little bit wider and a little weaker. They do have problems in their intimacy. It is noticeable to a point that with time it can be a real problem.
Okay, now you were telling me earlier that if you're planning on having more babies, this probably isn't the right time, but if you're done with babies, this is a good idea and you need to come see Dr. Sabella. Thank you. Thank you so much for talking with us today, Doctor.
Thank you, Connie.
Okay, ladies, no big deal if you've had babies and you want to feel young again. Dr. Sabella can fix it for you.
Thank you, Claudia. And for more information, you can go and see one of the wonderful doctors at the Institute for Women's Health. They're on Floyd Curl Drive, Suite 900, and they do have other locations available. You can give them a call or log onto their website to find out exactly where those are, ifwh.org. And we also want to remind you about their big event they have coming up. It's the Institute for Women's Health, their Los Luchadores 5K Fighting for Women's Health Run and Walk happening Saturday, October 11th at Olmos Basin Park. It starts at 8 a.m., $35 to register, $40 if you show up on race day. And kids 14 and under, it's only $20. And all of the proceeds from this wonderful event benefit Seton Home. You can log on to their website for more information, ifwh5k.org.